This is just going to be a short review of the physiology of the peripheral nervous system to help you better understand the drugs associated with the peripheral nervous system. We have the central nervous system that encompasses the brain and spinal cord, and the peripheral nervous system that works on the somatic and autonomic systems. And under autonomic, we have the parasympathetic, sympathetic, and somatic motor system. The somatic motor system controls our voluntary movement of muscles. There are three principal functions of the autonomic nervous system. We have the regulation of the heart, the regulation of our secretory glands, so saliva, gastric fluids, sweat, and our bronchial glands. And they also will help regulate the smooth muscle, like the muscles of our bronchi, blood vessels, the urogenital system, and our GI tract. And so these regulatory activities are shared between the sympathetic and the parasympathetic divisions of the autonomic system. Remembering that there's two branches of the autonomic system. So first we're going to talk about the functions of the parasympathetic nervous system, and they perform 7 regulatory functions. We're going to have slowing of our heart rate, increased gastric secretions, emptying of the bladder, emptying of the bowel. It does help with focusing the eye for near vision or accommodating for near vision, pupil constriction, contracting the bronchial smooth muscles, and just how the parasympathetic nervous system elicits these responses, we're actually going to be talking about in more detail under a different section when we talk about cholinergic receptor subtypes. The sympathetic nervous system has 3 main functions. We have the regulation of cardiovascular system, we have regulating the body temp, and we also have implementing the acute stress response, or what we commonly like to call it the flight or fight reaction. The sympathetic nervous system does have multiple influences on our heart and blood vessels. When we stimulate the sympathetic nerves to the heart, this will increase cardiac output. Stimulation of sympathetic nerves to the arterioles and veins will cause vasoconstriction, and the release of epinephrine from the adrenal medulla will result in vasoconstriction in most of the vascular beds and vasodilation in other ones. And when we influence the heart and blood vessels, the sympathetic nervous system can achieve homeostatic objectives like maintaining blood flow in the brain, maintaining and compensating the loss of blood that is primarily through the function of vasoconstriction. And we can redistribute blood flow during times of increased activity or exercise. In terms of body regulation, the sympathetic nervous system will regulate blood flow to the skin. The sympathetic nerves increase or decrease heat loss. And this is how that is being regulated. By dilating surface vessels, our sympathetic nerves will increase the blood flow to the skin and accelerate your heat loss. But conversely, when we constrict the cutaneous vessels, we're able to conserve heat. Another way that the sympathetic nerves work is on the skin is through the sweat glands that promote the secretion of sweat, and this helps our body cool down. By inducing piloerection, which is when there is like goosebumps or your hair on your body sticks up, the sympathetic nerves promote heat conservation in those cases. So if you think about with piloerection or goosebumps, this occurs usually when you're cold. So you're trying to promote that heat conservation. In the fight or flight, when we are in an acute stress inducing situation, the sympathetic nervous system will orchestrate this response. By increasing our heart rate and blood pressure, it's going to shunt blood away from the skin and viscera, and it's going to move it into the skeletal muscles. It dilates the bronchi, improving oxygenation. It's going to dilate the pupils and help, hopefully, with your visual acuity. And it's going to help mobilize all that stored energy, providing glucose to the brain and fatty acids for the muscles. Many therapeutic agents produce these effects by altering the functions under sympathetic control. The drugs are used primarily for the heart, the blood vessels, and the lungs. When we have drugs that affect the cardiovascular function, think about drugs that help with hypertension, heart failure, angina. We have drugs that affect the lungs that work on the sympathetic nervous system. These drugs are primarily for the use of asthma treatment. There are three main transmitters in the peripheral nervous system: acetylcholine, norepinephrine, and epinephrine. And at any one of the given junctures within your peripheral nervous system, only one of these transmitters are going to be there with the, to pick up these substances. There's a fourth compound, dopamine, but this role isn't demonstrated conclusively, and so we don't really talk about it in terms of a neurotransmitter in the PNS. So just remember acetylcholine, norepinephrine, and epinephrine. And in order to understand the pharmacology of the drugs that we use for the PNS, we have to identify the transmitter employed at each of the junctions of the PNS. So acetylcholine is a transmitter at most of the junctions of the PNS, and it's released by all the preganglionic neurons of the parasympathetic nervous system and all the preganglionic neurons of the sympathetic nervous system as well. Additionally, all the postganglionic neurons of the parasympathetic nervous system and all motor neurons to the skeletal muscles. And lastly, you're going to see it at most of the postganglionic neurons of the sympathetic nervous system. And those are the ones that go directly to the sweat glands. The peripheral nervous system has these different types of receptors that will help us to understand what we expect these medications to do. And so we're going to talk about these in a little bit more detail. There are the primary receptor types of cholinergic or adrenergic. Very basic receptors associated with the PNS, okay, the basic categories. And the cholinergic receptors and their adrenergic receptors are the ones that you're going to find. The cholinergic receptors are those that are going to mediate the response of acetylcholine. And these receptors will mediate responses at all the junctions where acetylcholine is the transmitter. The adrenergic receptors are those that are going to mediate epinephrine or adrenaline, right? In addition to epinephrine, they're also going to mediate norepinephrine. They're going to mediate the responses at the junctions where norepinephrine and epinephrine are the transmitters. So we have three different types of transmitters, but we have two different types of receptors. Cholinergic receptors mediate responses to acetylcholine, and again, the adrenergic receptors are going to mediate the responses of epinephrine and norepinephrine. However, in terms of cholinergic and adrenergic receptors, not all cholinergic receptors are the same, and not all adrenergic receptors are the same. For each of the two major receptors, there are different subtypes. For cholinergic receptors, we have three major subtypes. We have nicotinic N, nicotinic M, and muscarinic receptors. And for the adrenergic receptors, we have four major subtypes. We have alpha 1, alpha 2, beta 1, and beta 2. The peripheral nervous system you see here. This is now a schematic of what we talked about, and so now it should be more of a review as you're looking through this. We have acetylcholine, norepinephrine, and then we have epinephrine. And at any given junction, that peripheral nervous system will use one of these transmitters. So here you see acetylcholine. being the primary transmitter at the parasympathetic nervous system, but we can also see acetylcholine at the sympathetic nervous system and the somatic motor system. Additionally, in the sympathetic nervous system, we have norepinephrine and we have epinephrine as well. So in talking in more detail about acetylcholine and the lifespan or the life cycles of these transmitters, we're going to focus now first on acetylcholine, next on norepinephrine, and then epinephrine. So this slide is about acetylcholine. And the cycle begins with the synthesis of acetylcholine from two precursors. Acetylcholine is made from choline and acetyl coenzyme A. After the synthesis of acetylcholine, it's going to be stored in vesicles and then released into action potentials will release a response, right? And after the release, acetylcholine will bind to the receptors. And remember, there's 3 different receptors that potentially acetylcholine can bind to: nicotinic N, nicotinic M, or muscarinic receptors. And they're all located in postjunctional cells. Now, when they disassociate from the respective receptor, acetylcholine is going to be destroyed almost instantaneously by acetylcholinesterase. And this is an enzyme that we have in abundance in our body at the surface of the postjunctional cell. It's going to degrade acetylcholine into inactive products now. It's going to reduce it back to choline, but now acetate. The uptake of choline into the cholinergic nerve terminal will complete the life cycle. And then choline, which is the inactive substance, and acetylcholine, both of them can be taken back up for reuse again, and it can be recycled, and this cycle can continue. We have both therapeutic agents and toxic agents that can interfere with the acetylcholine life cycle at several points. And so if you can understand at what point it's reacting at, then you can understand the mechanism of action or where we're trying to stop this process from occurring. For instance, botulinum toxin or Botox, it's going to inhibit acetylcholine release. But we have a number of agents, medications, and poisons that act on the cholinergic receptor, which will mimic or block the actions of acetylcholine. And we also have some agents that act by inhibiting acetylcholinesterase instead. And then this will cause acetylcholine to accumulate in that junctional gap. Norepinephrine is a little bit different. Remember that this cycle is going to start with the synthesis of norepinephrine, and this is really from a series of precursing events. The final step of synthesis will take place in the vesicle where norepinephrine is stored, and then it's going to be released. It's going to bind to the adrenergic receptor, and it will interact with a postsynaptic alpha 1 and a beta 1 receptor, not beta 2 receptors. And it can also interact with presynaptic alpha 2 receptors. Once this transmission is terminated by the reuptake of norepinephrine into the nerve terminal, after reuptake, it's undergoing 2 different things. It can either go back into the vesicle to be reused again and repeat this life cycle, or it can inactivate by the monoamine oxidase, or the MAO, MAO. And this is an enzyme that's found in this nerve terminal. On every step of this cycle of norepinephrine can alter their it can be altered by a therapeutic drug agent. And we have drugs that can either alter the synthesis of norepinephrine, the storage within the vesicle of norepinephrine, or the release of norepinephrine. And we have drugs that will also act on the adrenergic receptors to mimic or block the effects of norepinephrine. Drugs like cocaine, tricyclic antidepressants, or TCAs, they inhibit the reuptake of norepinephrine, and then they're going to intensify the transmission. We have drugs that inhibit the breakdown of norepinephrine by MAO. You might know these as MAO inhibitors or MAO inhibitors. They're going to cause an increase in the amount of transmitters that are available for release. And then epinephrine. So epinephrine is much like norepinephrine. And we're going to focus, though, on the significant differences as well. It's going to begin with the synthesis of epinephrine within chromaffin cells of the adrenal medulla. These cells produce epinephrine, but first they make norepinephrine to do this. When norepinephrine transitions to epinephrine, it's converted enzymatically to make epinephrine. The sympathetic neurons lack the enzyme that's needed to convert norepinephrine to epinephrine, so it's not produced in the sympathetic nerves. After the synthesis of epinephrine, it's going to be stored in the vesicle and it's going to wait until it's needed and released. Once it's released, epinephrine is going to move through your bloodstream. It's going to target the organ throughout the body, different organs, and then it's going to activate either the alpha 1 and 2 or the beta 1 and 2 receptors. Termination of this substance, epinephrine, is going to be completed through hepatic metabolism, not the reuptake into the nerves.